So it's a pleasure to be here with Susanna and Sana and to be ahead of Jamie. It's always better to go before Jamie than after Jamie. And what I'm going to do is talk about three choices. And since I'm a geek, I'm not going to be up here. I don't have an emotional story about this because I tend to look at things from a data perspective. But it's important to look at things from a data perspective if we're talking about managing healthcare information, because what we've seen over the last 20 years is that it's become a data game. So the first question I want to ask everyone here, right, is have you ever entered your zip code, gender, and birthday on a website to register? Okay, it's a pretty good number. So here's an example. I pulled this up this morning, just looking for a website that would ask you for this. This asks you to put in your children's name, gender, and birthday. Now, I doubt that you would recognize this, but actually that's all you need. 87% of the people in the United States can be uniquely identified by this combination of information. I mean, think about that. It was a woman named LaTanya Sweeney. I'm going to come back to her work in my second question. And so we have this belief in anonymization, and we use it actually to make data less useful in order that we can transfer it around. And so that's why the first choice really is anonymous or useful. And I owe another quote. This is from a guy named Paul Ohm. He's a professor at the University of Colorado, which is that it can either be useful or perfectly anonymous, but never both when we're talking about data. Now, this myth of anonymization sits really at the core of our entire privacy laws around health information, because the idea is we can de-identify and then we can share stuff. So let's say we have useful information. This is a graph from 1997 from the National Academies that shows your health record moving around through the system. 1997, right, a year before Google was founded. So it's safe to say that this is a lot more complicated today than it was in 1997, 13 years ago. But you can track, right? So your retail pharmacy, your pharmacy benefits manager, they've got patient-identified information. So does your clinic, your care provider, managed care, life insurance, health insurance, lawyer and malpractice cases, accrediting organizations, physicians, and the State Bureau of Vital Statistics. Right? They've got identified information. Everyone with a dotted line has what we would call quote-unquote de-identified information. But the thing about it is, because that information has to be useful, it's not actually perfectly anonymous. And here's the weird thing. What about if you want to give it away? So we've heard in the last two speakers about the importance of sharing, or the desire for sharing. So we've got all these systems designed to protect us. And this is going to be something that we track across whether it's copyrights or patents or privacy. We have a system where the default rules are actually don't share, and if you'd like to opt out, it's complicated. So if you want to give away some of your health information or your genetic information, what's it look like? So I see Esther here. Esther's part of the Personal Genome Project. She's actually been through this. So if you'd like to give away your genome, as well as some answers to questions about your health, it's really complicated. You have to go through a multi-part test. So it's a 6-part test. The passing score is 100%, 60 questions. I have not yet managed to get 100% on this test, and I've tried multiple times. Now, if you pass the test, that allows you to sign up, which allows you to go to your doctor, who then verifies that you passed the test yourself. And this is the beginning of a multi-month, complicated process to give it away. So we talk about wanting to share and the importance of sharing, but the reality is the system is set up that if you want to give it away, it's actually much harder than it is to just do nothing. So choice number 2 is related to choice number 1. Choice number 1, anonymous or useful. Choice number 2 is integration or privacy. The reality is that this is a very important choice, because the things that give us privacy are the things that break integration. And integration is where we get the power of many kinds of data networks. So here's an example going back to that last bit of zip, gender, and birth date. So we have Mr. X. He lives in 02138. I used to live there. It's in Cambridge, Massachusetts. He was born on July 31st, 1945, and we know he's a man because of the Mr. Now, Massachusetts released a whole lot of health information several years ago. And they released what was called de-identified health information, but it did have the zip, gender, and the birth date. Now, an enterprising graduate student, LaTanya Sweeney, cross-referenced this to the voter data, which had names, birthdays, and zip codes. And she was able to find out and for example, that Mr. X in this case was the governor of Massachusetts, and she had his health record. She mailed it to him. Now, when you spend a lot of time hanging out with privacy hackers or talking to privacy hackers, and you see all the kinds of data here, and you say, well, if all I need is your zip code, your gender, and your birth date, what I've actually got in your health record is what they call a large attack surface, which is the kind of phrase you're going to hear from people who break privacy databases. So the integration capability came from joining one form of public information that was relatively de-identified, which was the public health records, with some other information, which is the voter data. And it's by bringing the two together that it became very easy to uniquely identify people. And it's that same power, actually, that gives us the ability to do good things for people. Google uses it to sell you good advertisements. Right? That kind of integration allows us to find those unexpected coincidences and synchronicities that help us understand our own health and our own data. But the system isn't set up to facilitate that. And it works at the research level, too. Again, I'm coming more from the research and geek side. And it turns out that if you can take genetic data, public genetic data, if you can take expression data, and if you can take clinical data about one person, so the expression data would be what your genes do in reaction to a drug or to a disease. The genetic data would actually be your genetic variations. And the clinical data would be what your doctor talks to you about your health. If you can bring those three things together, you can do some really interesting analysis of genetics. You can find out when it is that your genes activating causes you to have a clinical trait. You can find out when it is that your genes are actually reacting to the clinical trait itself, because that's a different thing. And you can find out when those things are independent activities. And as simple as that may seem, it's revolutionary in the context of doing research into drugs. Now, again, what if you want to give it away? So I work with an organization called Sage Bionetworks. It's a nonprofit organization. Merck Pharmaceuticals basically took their disease biology group and open sourced it through Sage Bionetworks. One thing we were trying to do was to give away all of this data, the genetic data, the gene behavior expression data, and the clinical traits. We have, unfortunately, a much longer list of data sets that are requiring release because the default system makes it impossible or complex to give it away. Then we have a list of data sets available for use right now. So the default system we've got doesn't perfectly anonymize, and it doesn't make it possible to share. In many ways, what we have is not the best of both worlds. So the third question, and the third choice, is actually perhaps the deepest question, which is that there's this unarguable benefit that the network effect brings us. It's brought us this in consumer goods. It's brought us this in music and culture. And we're going to have it for data, because the power of the network is too strong. It's not going to be resisted. But the question really is the monopoly going to be open or closed? And I'm going to explain what I mean by that. So a lot of people here have iPods, iPhones, iPads. I do not. I run an Android. I recently finally got off the Mac addiction. But the reality is that a device is useful enough and integrated enough, people will give up their rights willingly. Right? I used a Mac for years. My mom uses an iPad. It's awesome for her. Because it is so useful, she doesn't recognize that it's actually taking away rights she's had her whole life. So what if you wanted to give something away that was on your iPod? You'd have to find a piece of software called Snooty, which is iTunes backwards, and use that to pull the music you bought off of your iPod onto a different machine that you own. Have you ever seen a used CD store for iTunes? It doesn't exist. Because when you buy a CD, you buy the right to resell it. When you buy a book, you buy the right to resell it. In the digital world, you don't get that right because you're not an owner of the content, you're a renter of the content. And you've lost the right to make even a copy for yourself without having to go to some significant lengths, and in many cases, to actually violate rights. Now, let's contrast that over time to an open monopoly system. So closed monopolies really do prefer these incremental changes. I loved that we heard the bit about incremental innovation earlier. Because incremental changes and innovation are what we get in these closed ecosystems. So the iPhone 4 is thinner, and it has a little faster, and it's got a camera on the front, but it's still fundamentally a phone. And so I spent years at MIT, and I've had a professor there who used this as his example of incremental innovation, which is the first person to figure out that your ear was an information gathering device who invented the ear horn. Now that was a radical innovation, right? And you think about incremental innovations in ear horn technology, and over time you wind up almost inevitably at these giant horns that were used to listen for incoming enemy aircraft. Now, let's sort of think, would the contractors who had this contract have welcomed research into radar? Because radar was a truly disruptive technology that destroyed the idea that having bigger ears was all you needed from an air defense perspective. Enclosed systems are the sorts of systems where the people who own the ear horns can prevent you from doing research on radar. They can use the law, they can use contracts, and they can use the network effect to maintain that powerful position. So let's contrast that to what I would call an open monopoly, which would be the internet. So the entire internet emerged from this sketch in 1969. Let's think about that. It's an open monopoly in the sense that anyone can connect an internet server, but it has to use TCP/IP, which is the fundamental internet protocol. You're not allowed to write your own internet protocol and connect to the internet that we all use. You can write your own protocol and compete, right? But sort of like Henry Ford, right? You can have any color you want as long as it's black. Now, because of the way the internet was designed, because you didn't need permission to run a certain program or to do a certain kind of work, we got the World Wide Web. And the entire World Wide Web comes from this one page. But again, it was an open monopoly. As long as you used HTML and HTTP and the standard systems, you could put up any kind of web page you wanted. And anyone who used the web could see it. So even though we didn't design the internet to get the World Wide Web, we got it. Even though we didn't design the World Wide Web to get Wikipedia, we got it. And now we're starting to get into a content layer. So the Wikipedia, you don't just have to use the standard software, but you've got to use the standard legal tool that allows that remixture of shared content to happen. Because copyright law, as it's set up, means that if you want to give it away, you've got to use a legal tool to do it. And full disclosure, I work for an organization that provides the legal tools that underpin Wikipedia and over 500 million objects on the web. Right? We're starting to learn that the digital legal systems need the same sorts of standard monopolies, open ones, that underpin the technology. So each of these systems, we have what we would call a digital commons. And so it's sort of depressing, but if you play word association with people, the most commonly associated word with commons is tragedy. And it says an awful lot about a society that we think about commonly held resources as tragic. This comes from a 1968 Science article, which is talking about rivalrous resource consumption, the idea that if I had a goat on the common green land and Jamie Haywood had a goat on the common green land, we would have an incentive, each of us, to maximize the number of goats, and the grass would be destroyed. And this is the tragedy of the commons. But the reality is, in a non-rivalrous world, we don't have the same sort of consumption of resources. If my data set is online and 5 people use it, my data set hasn't been degraded. The problem is we have what one of my mentors, Jamie Boyle, has called cultural agoraphobia. We have this fear of open spaces that has come out from years and years and years of aggressive copyright enforcement, mainly out of the movie and music industries, that's ignorant in many ways of the potential that comes from shared information. So the goal of what we do at Creative Commons is to standardize those legal tools so that the people who want to share are able to share. It's not about mandating it. It's not about forcing. But it's about making sure that the people who actually want to share are able to do it. Digital Commons is really more about a public footpath than anything else. It's a set of rights of way that are pre-negotiated and available to everybody on the same terms. Much the same way that the technology protocols of the internet and the web are available to anyone in the world on the same terms. A public footpath is actually a very good thing for society, especially when we're talking about information sharing, whether it's about where your pillows should be organized on your bed, or about the sort of information you have about your cancer, or whether you decide you want to participate in a public study and make your information available. Now, there are impacts to this that haven't been addressed. Things like genetic discrimination. Those cannot be addressed simply by keeping things private, because as long as we make that data useful, you will be identifiable. We've got to begin thinking about non-discrimination protection, extending the legislation we've already got on genetic information non-discrimination. And again, as a society, starting to understand that we have some choices to make, and in many cases, those choices are irreducible. So are we going to be open, or are we going to be closed? Are we going to be private, or are we going to be integrated? Are we going to be useful, or are we going to be anonymous? Something will emerge to answer these three questions. And the answers to the choices we provide are going to really dictate the kind of society we get that comes out of that. And I would propose that any solution that comes out needs to be subjected to the test of how easy it is to give something away if we want to do so. Thank you.